Do you feel lost when you look at brain images? Do you ask yourself, why do I need to look at brain images if I've got the radiology report? I'd like to answer these questions with a case study. This week I consulted a clinician on a case of a 30-something-year-old person who had a brain tumor removed 5 years ago. The problem the clinician had was that this person was changing significantly. Their clinical presentation was deteriorating quickly, and a recent MRI scan, including radiology report, did not identify any changes in the status of the tumor or any new tumor. Furthermore, a recent psychiatrist letter did not shed any new light into what is causing this clinical deterioration. The family was reporting a significant impact of those changes on family dynamics and family safety, and the clinician wanted to find out what is going on and what should they do. So the first thing we did, as you can imagine, we looked at brain images. And when you look at brain images in cases like these, you want to look at the most recent brain scan and you want to look at the scan that was done before the last scan. In this case, we had a scan from this year and a scan from 2 years ago. Both were MRI scans. The first thing we want to do is just verify what we saw in the radiology report. Of course, they're going to be accurate with their assessment because that was the clinical question. The clinical question was, is there a return of the tumor or some new tumor? We looked at the scans and indeed there was no change in the status of the tumor. There was no new tumor. But why is the clinical deterioration? So as rehab clinicians, one of the considerations we would take in such circumstances is whether there is inflammation, an increase in inflammation that could cause these symptoms. So we looked at the amount of inflammation in the recent scan and the one from 2 years ago, and to our surprise, we found that there was no difference, meaning that inflammation was not causing these new clinical symptoms. However, what we did find was that there was brain atrophy that was more significant in the recent scan compared to 2 years ago. Furthermore, the symptoms that the clinician was reporting matched the pattern of atrophy that we identified. So by analyzing the scans systematically, we identified something that was possibly causing those symptoms. We found the cause, which means that then we can communicate using data from brain images to say to people who are qualified to make that diagnosis, like neuropsychologists, neurologists, psychiatrists, this is what we're seeing, this is what we're suspecting, could that be possible? It also changes the way we manage this patient, because all of a sudden the problem is not the tumor, it's something else that is going on. Therefore, our management is going to be different. The way we're going to set our goals and the recovery we're expecting is going to be different. The way we're going to instruct the family and communicate with the family is also going to be different. And finally, the way we're going to communicate with funding bodies is going to be different. This case shows you that looking at the radiology report alone is not enough. You, as rehabilitation clinician, need to look at the scans, at the images, so that you can extract the rehab information that is relevant to you. You can do it, and I will teach you how to do it in a simple and systematic way whilst holding your hand. I know you can do it because hundreds of clinicians have done so before you.